I'm Dr. Katy Woodley. We're going to be talking about COVID critters and coffee. It's our weekly update. It's April 18th, 2020, and we've got some crazy things going on in the world. So, disclaimer, as always, this is for educational purposes. It's not intended to replace the advice of your own veterinarian or your own personal doctor. Can't answer specific questions about your pet's medical issues or make medical recommendations for your pet without first establishing a veterinary client-patient relationship. So now that we have that all aside, let's get going. So I'm Dr. Katy Woodley, holistic veterinarian. I am a Colorado native. I went to vet school in New Zealand, which was absolutely amazing. Been a veterinarian for about 10 years. My passion is holistic medicine though. I use acupuncture, Chinese herbal medicine, focus on nutrition, those things that we can do to help boost our pet's immune system. I am located in Fort Collins, Colorado, but am able to do phone consults wherever you are. So our mission is to create healthier pets and happier pet parents through holistic medicine, regardless of their location. There are not enough holistic practitioners out there. The human side is definitely growing, the vet side is growing. However, it shouldn't mean that your pet doesn't have access to that care just because there's not a veterinarian that does this by you. So stay tuned for that information at the end. So as we all know, unless you've been living under a rock, what is COVID-19? It is this awful coronavirus that has pretty much shut down the entire US, the world. So it's a group of beta coronaviruses, and it was called the SARS-CoV-2. And this is a large family of viruses that are common in people and many different species of animals. So this includes camels, cattle, cats, and bats. So that's really important to remember. Cats previously, so they're prone to coronaviruses. So feline infectious peritonitis is a coronavirus that can make them really, really sick. And so that's a different form of a coronavirus. However, we're starting to see how this is playing out in some of the species that are more prone to these types of viruses. Of course, as we all know, it was first detected in China, and now it has spread internationally. So updated numbers, this is something that we talk about each week because it's good to see kind of where we're progressing. I don't have deaths on here. However, what we can see is that the cases in the US are significantly jumping each week. Now, last week, I believe it doubled, so it didn't double this time. Global cases, though, were still rising consistently. Now, there's been a lot of news articles. Keep in mind, these are diagnosed cases. That means that people are being tested. They're saying that they think that the numbers are probably 85% higher than this. But what that means is actually really good, is that most people are recovering. However, this is still really important because those people that do need that extra care, so like a ventilator, that's why we're staying at home. That's why we're social distancing. That's why we're home quarantining, because if they don't have the access to a ventilator, they can die and pass away from it. And we're seeing a lot of deaths from this virus. So what is a pandemic? It's a global outbreak of disease. It happens when a new virus emerges, infects people that don't have antibodies to protect themselves from it. And this virus is highly infectious. So that's the difference. So typically the rate of infection is higher. So one person will infect 3 people. That's a really high rate of infection. So that's why there's such a big problem with this. And there's a lot of people that don't feel like they've come into contact with it who are getting sick from it. And that's because it can survive on surfaces, it can spread in the air. There's a lot of different ways that this can spread and infect people. And because there's little to no pre-existing immunity against the new virus, it's spread worldwide. People travel, they've been on planes, we go outside and we come into contact with people every single day. Going to the grocery store, we can come into contact with it. This is the first pandemic known to be caused by the emergence of a new coronavirus. So how does it spread? Of course, this is when there's contact with an infected person's bodily secretion, so saliva, mucus droplets, and a cough or sneeze. And then we go and we either come into direct contact with that, so if someone sneezes or coughs on us. So of course, make sure you're coughing and sneezing into your arm. So make sure you're keeping that away from going out into the air, or if you're touching a contaminated surface or object. So we call that a fomite. So smooth surfaces like countertops and doorknobs, those can transmit viruses a lot more readily than say like a porous material. So that's like pet fur. And so that's really important to remember. We're not certain about pets being fomites. However, keep that in mind when you're potentially touching your pets. So can your pet get sick and spread the disease? This is like the #1 question for pet parents worldwide, something that I get every single day that we need to know, because this is really scary. All of you probably watching this have a pet. Like, comment below, heart if you have a pet, if you're on Facebook watching this, because most of us do. And so the thing is we've got some dogs that have tested mildly positive at the start of this that were in Hong Kong, that were with owners that did test positive and were sick from it. However, those dogs didn't show any symptoms, so they did not get sick. A cat in Belgium tested positive, but they weren't certain of the strain. Most likely, it probably was COVID-19 because they were in a household with someone that was infected. And a cat in Hong Kong tested positive and was not sick. So there's signs there. However, recently, tigers in Bronx Zoo tested positive for COVID-19, and their handlers actually were positive for COVID. So there's no evidence at this point to indicate that pets can spread COVID-19 to people. But what about pets spreading COVID-19 to other pets? So that's something that there's been a lot of research going on right now, because cats are prone to coronaviruses, and same with ferrets. And it's a different strain that they traditionally have, been exposed to and get really sick from. And so what they found in research studies, and this is not like a natural environment. So what they're doing is they're directly infecting the cats by putting the virus up their nose. That is not a natural way of infection. So very high loads of the virus, and the cats are getting sick. So they're finding that these cats also can spread it through the air. This does not mean that you need to go give up your pets and send them to the shelter and be afraid. They are a dead-end host, meaning that they don't transmit it back to us at this stage. So, but it is very important to remember. So if you are sick with COVID, you don't want to necessarily like be snuggling your cat in your face. There are no signs or evidence at this point that dogs contract it very readily. We think about how many people have been exposed and how many pets are showing symptoms or being like, there's thousands of pets that have been tested too, like very low risks for your pets to get infected. But cats, we do have to be careful with, and ferrets we need to be careful with. And that doesn't mean giving up your pets. So please, 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 please don't do that. So can pets serve as fomite? So that means if the virus is on their fur and they come to us and we touch them, are we able to become infected with COVID? So remember, this is primarily a person-to-person infection. So you need to come into contact with a person's bodily secretions, so like saliva, mucus droplets when someone coughs or sneezes. It's still unclear if like the virus survives for a really long time on your pet's fur. Remember, it's a porous material, so these viruses don't tend to last long. However, you need to be careful. And so you want to be using a washcloth. Wipe them down after going for walks, especially if they come into contact with people or other pets. Now, of course, we're supposed to be doing the social distancing 6 to 10 feet apart from each other. So, however, if someone comes up and pets your dog, because that's a common thing, right? It's really hard not to. You just want to wipe them down with a washcloth. Do not use Lysol on your pets. Like, there are cases of people burning their pet's skin because they're afraid, and they're using Lysol, which is something that's recommended to clean with to kill the virus. So do not use those traditional chemicals that are really, really strong to kill the virus. So the other thing is making sure that you're regularly cleaning your pet's food and water bowls, bedding material, and toys. I also am going to give a shout out. I'm going to break the COVID talk, so because I can see one of our newly adopted senior cats in the background. And if you watch her, she is a troublemaker. she is going to get into that closet. So anyways, I just had to like break the COVID talk because you're going to watch magic happen soon, and I'm not going to yell at her, and I'm going to just let her have fun with that. So anyways, make sure you're regularly cleaning your pet's food and water bowls, bedding, material, and toys. And if you're washing your dogs, washing your cats, which she needs to be done, she's a little terror. Make sure you're using like pet shampoo and things to wash them. So what happens if you're sick? What do you do for your pet? So remember, this is primarily spread between people. So not pets back to people. We may potentially infect them though, especially our cats. So you need to stay at home, call your medical professional to get advice on what to do. Wear a face mask. We should be wearing a face mask for going outside. If you're sick, wear a face mask all the time at home, wash your hands frequently, and separate yourself from other family members. So most likely other people in the house are going to be in contact with it. They're potentially going to get sick too, but you can wear a face mask and prevent the spread of that virus from contacting pets and other people in the house. You need to tell your physician and a public health official that you have a pet or other animal in your home. And then that way they can decide if they need to go and test those pets. And limit your contact with your pet if possible. Of course, that can be a little bit harder, but especially if you have a cat, if your cat's okay with you not really engaging and interacting with them, definitely keep away from them, wear that face mask so you can limit the amount of potential virus that they come into contact with. If you have a service animal or you must care for your pet, you need to wear a face mask, remember that. Don't share food, kiss them, or hug them. Remember, bodily secretions contain the highest amount of virus. And then wash your hands before and after any contact with your pet or service animal. COVID isn't like the only thing that can potentially be spread. There are other diseases that we can get from our pets. Remember, dogs lick their butts, same with cats. Like, we do not want to be ingesting that, especially if we're going to be talking about immune health. A lot of dogs also eat their feces. So, you know, limit your kissing and touching and things like that with them, especially right now when we're trying to maintain optimal immune health. So what are the best ways to prepare for times like this? So grocery stores are limited with a lot of things. It can be harder to find pet foods. I know a lot of local food stores, so Pooter Pet Feed, they're fantastic. Kreiser, there's a lot in this area in Fort Collins that are doing local deliveries, which makes it amazing, so you can still support them. So what does your disaster kit prep look like? You want to make sure there's enough food and water for your pet for 2 to 4 weeks. You need to ensure that they have enough medications for 4 weeks. I can tell you through ordering drugs and other supplies, you need to make sure you have enough medications for 4 weeks because there's going to be potentially back orders and supply chain issues because a lot of things come from China. So have your vet's phone number and the ER clinic number available in case you need to take your pet or someone else needs to take your pet too. So make sure you contact family members or neighbors to see if they can help you if needed, and then get a first aid kit for your pet. So a lot of the local pet stores or Amazon will have first aid kits that you can get for your cats or your dogs, as I watch her destroy our house. Enjoy! You guys have frontline seats to watching this newly adopted cat who has been in our home for about 4 days, just having a blast. So in the background. So vet visits. Many vets are still open. We are an essential service and they're seeing patients on a limited basis. Make sure if you need to take your crazy cat, that one in, or your dogs, you call your veterinarian before showing up. That's really important, especially if you're sick. You need to tell them that you've been sick so that way they can take extra precautions. And if you can, have another family member or a friend take your pet to the vet for you. So like I mentioned previously, testing for COVID-2 is actually available for animals in the US, but it's not a test that you can ask for. IDEXX has been testing thousands of pets that have potentially come into contact with this virus. So when you do need to take your dog or your cat in, if they have upper respiratory signs, they're acting sick, if you know that you have been infected, you need to tell them. So that way they can decide if that test needs to be done. And then remember, cats and ferrets replicate this virus more readily than dogs. but there is no sign yet that they can pass it back into humans. So remember, like, what do we need to do? We need to flatten the curve, right? So this doesn't necessarily mean we're not going to come into contact with this virus. Most likely, all of us at some point will come into contact. It doesn't mean you're going to be sick. However, what we're doing is we're making sure that our healthcare system can provide the services that we may need if we do get sick and need to be on a ventilator or hospitalized. So that's why social distancing, home quarantine is really, really important. So what are the things that you can do to optimize your pet's health? Like, nutrition is the foundation for health. This is something that we always talk about. And if we're not feeding our pets an optimal diet, how is their immune system going to be at the highest place that it can possibly be? So minimizing disease. So if they come into contact with this virus, and same with us, if we are not feeding the body what it needs, how do we expect it to fight off that infection? So cats are obligate carnivores. What does that mean? That means that they need meat for their diet. Right now, with the two that we have, I can tell it's going to be a long road ahead. So they came to us. I can tell one is addicted to kibble, doesn't like other canned foods, meats, real meats, even like sardines. So I've been trying all sorts of things to transition over. It's going to be a very long process. And the way that you can transition cats onto an optimal diet, so canned food is always going to be better than kibble. The next step up would be like a dehydrated raw. And then the next step up would actually be a raw food diet for cats. You don't want to jump immediately. And the reason why is that we can cause upset tummies. If they've been eating a kibble diet their entire life, they may not have the microbes. So their microbiome is not prepared to handle a raw diet and digesting those foods appropriately. So we need to work them up to it. So using things like probiotics, digestive enzymes, things like that to help improve the microbiome health are super essential. A lot of cats can take 4 weeks, maybe even 2 months to transition from a kibble diet over. Some cats can't transition. So I'm hoping for my own case that I can get this little terror that you've been seeing running around. She's my kibble addict. Need to get her off of that. She's an older cat, and I know it'll benefit her joints and her overall immune health if we can get her onto a more appropriate diet. With dogs, they tend to need more fiber in their diet, so with their digestion. So adding in fruits and vegetables can be beneficial. So right now may not be the best time to transition a dog onto like a home cooked diet or even a raw diet. Remember, transition is the key word. You never want to switch over 100%. However, the things that you can do is add in lightly steamed broccoli, lightly steamed kale, your spinach, adding in romaine lettuce. You can add in cooked mushrooms too. So those button mushrooms, those are really, really good for the immune system. So you only want to add in like 1/4 of a cup, depending on your pet size. So that'd be like a large dog. I would say, 1 button mushroom, cut up that and lightly cook it if you have a small dog, and that's per day. And that's going to help their immune system. So using some of those real foods mixed into their kibble. And then once we get through this and food is more widely available, then you can transition your dog onto a balanced home cooked diet or a balanced raw food diet. So what I mean by saying balance, we need to ensure that the vitamins and minerals are in the right ratios, so we're not causing other health issues long term by feeding them. Say, I see a lot of people make the mistake where they just put down like chicken and some carrots, and that's not a balanced diet. So that's really important to remember, that we need to be adding in those vitamins and minerals in the right ratios. There's certain brands that I use. We can formulate those diets for you too. That's part of some of the services that we offer at the Natural Pet Doctor. So reach out if you want help or you need some guidance. That's what we're here for. So I love this because it's just, we've all got to laugh during this time, right? So there's a lot of stress, there's a lot of anxiety. So seeing some of these memes may seem insensitive. However, we do have to remember to laugh. Like, remember to bring joy to the day and look at some of these funny things. Look at the videos of your pets doing crazy things, the pictures of your pets. We just lost our beloved Finn, who was our soul pup. Like, watching those videos makes me sad, but it also fills my heart with joy. Watching these cats destroy my house, maybe not so much. However, they're not in a kennel, they're not at the rescue, they have a home for life. And that makes me very, very happy. When we're social distancing and we're in home quarantine, you still can go for a walk. This is really important for our dogs and their overall health. And this is really important for our overall health because we don't want to be gaining a ton of weight. We don't want our pets to be gaining a ton of weight because what that extra fat does in the body is it releases more inflammation. Extra inflammation, so there can be healthy inflammation, right? Where we work out, we lifting muscles, you're tearing some of those muscle tissues, and that's how you grow muscle, right? That's healthy inflammation. It resolves. It's acute. It doesn't continue to last for months and months. However, when we become overweight, so our pets, us, that fat sits there and it actually releases more inflammatory mediators. And so that sets the body up for this inflammation cascade. It can actually get worse. So it starts from inflammation, and then we can even transition into autoimmune diseases. From there, we can even go into other chronic illnesses like Cushing's and diabetes if there's chronic inflammation in the pancreas. And from there, we can go to cancer. That is the end game of inflammation, and we never want our pets to get to cancer because it's very, very, very difficult to reverse that. And a lot of times we have to use toxins like chemotherapy. We use a lot of herbal remedies and nutrition and supplements, but it can be very, very difficult to gain remission and remove the cancer permanently once the body has reached that state. So this is why nutrition, exercise, remembering to take care of ourselves, our pets are so in tune with our stress levels. How many of you had a dog that gets diarrhea or an upset stomach when you get really stressed out? That's the number one thing that I'm treating right now through all of this. Same with cats. Like watching how in tune these cats are with us already in 3 days, it's insane. And so if my stress level becomes unchecked and out of control, I know it's going to adversely affect them and it can adversely affect their health. So make sure you're taking care of yourself. Make sure you have your routines. Make sure you're like taking time to express gratitude for the things that we do have. We have safe homes. Even though it sucks being stuck in our home, we have a safe place to be. And if that's all we have to do, fantastic. So keep that in mind as you're looking at, okay, how do I support myself? How do I support my pet's health? There's so much we can do to control our health and our pet's health. So remember that when all seems lost and we're really, really stressed out, that can be a hard thing to remember. But we at the Natural Pet Doctor, we are here for you. My sole mission with my life is to make sure that pets have access to holistic medicine, because we can integrate that into conventional to ensure that your pet achieves optimal health and wellness. That is always the key. We don't want to wait until it's too late and they have other problems, other diseases, other conditions, because then we have to backtrack and it can be a lot harder to bring your pet back from that brink. So these are some of the resources that you can follow to make sure you're staying up to date, especially with pet health. There's a lot of myths out there and it can be really scary reading some of this stuff. And so the CDC, the American Veterinary Medical Association, the World Health Organization, the World Organization for Animal Health are great resources that are safe. You're going to know that their information is up to date and true. So that's very important to remember. If you have a pet and you're not sure if holistic medicine is for them, or they're acting weird or sick, or they just have some like GI upset and you're not sure what to do, or if you need to go in and you want a more holistic approach, or just some general advice, give us a call. We have telemedicine options and the price is really, really optimal. So that way you can assess whether or not your pet needs to be seen. You don't have to go into the ER and spend $200. And you also get some natural care. So with GI issues, what are the things that you can do? What are the bland diets? Are there other herbal remedies or teas that you can add into the food to help calm down their digestion so that you don't have to go in and have them hospitalized and on IV fluids and things like that? And then what's great from those, if you want to go into a more long-term care plan, we can apply that as a credit to your consultation for a longer-term treatment plan. So make sure if you're not already following us, follow us. We do this every week. We also go live throughout the week. We post a lot during the week. We release a lot of blog posts. So make sure you hit that follow button if you're on Facebook right now so that you get the updates and the live updates. We do have a pet membership also. We have a 2-week free trial for our Healthy Paws membership. All of the videos that we do, so we're focusing on anxiety and stress for dogs and cats this month. Those webinars are free, but guess where they go? They go into our pet membership, so you can rewatch them. You can see longer versions of them. You can see things that were released a long time ago they're all there. You want to know how to handle CBD for your pet? It's in our pet membership tribe. So check that out. Opt into our 2-week free trial. We'd love to see you there. I love engaging with our community and getting your questions asked. So check that out, thenaturalpetdoctor.com. The Healthy Paws membership, take advantage of that. If you're not on Facebook, check us out on Facebook, Instagram. We also have a YouTube channel. I'd love to see you guys there and subscribe to that. So does anyone have any questions right now? I see a few of you guys following along, which is great. I want to make sure we get questions answered. If you have questions about immune health, your own health, obviously I'm not a human doctor, but there's a lot of things that can kind of translate back and forth. Remember the disclaimer at the beginning. But there's a lot we can do to make sure that we are staying healthy, your pets are staying healthy, you are not stuck, you are not alone. If you need help, so you feel alone, you feel like there's nothing more you can do, you feel alone with your pet, reach out, give us a call, send us an email, join our pet membership tribe. We've got a lot of really awesome people there and great content for you to check out. So, all right, thank you all for attending, and I really, really appreciate you being here and taking the time on a Saturday morning to join us, and I would love your feedback. If there's other live video content that you would like to see from us, make sure you reach out, send us a message. I love hearing from all of you. All right, this is Dr. Katy Woodley, the Natural Pet Doctor. Take care.